Hello, let's spend the next few minutes learning what we need to know about COVID-19. So what is a coronavirus? Corona is named after the crown-like spikes that this virus has. This is a virus, the group, corona group, we've known for a very long period of time. But this particular virus, which produces this disease, which is now known as COVID-19, is new, and we know of it only since December last year. But there are two other viruses in the family that we are very familiar with, MERS and SARS, and the genome of this COVID-19 is similar to the genome of the MERS and SARS virus. What are the signs and symptoms of COVID-19? Fever, fatigue, dry cough, sometimes moving on to dyspnea, which is shortness of breath. Sometimes one can even vomit. One can have hemoptysis, which is bringing out blood in the sputum. One can get diarrhea, and basically one can feel unwell. And this can progress to developing severe respiratory distress syndrome requiring ICU care. Based on the work that has been published recently in the NHGM, after an analysis of the large number of cases that were seen in Wuhan, we now understand a lot about the epidemiology of this virus, the clinical presentations. We now know what the investigation profile looks like, and very importantly, we know about the course of illness. We know that the mortality rate by and large is between 1.4 to 2%. Outside China is reported to be much less, but the WHO reported on 4th of March that it might be as high as 3.4%. But we have to realize that when we look at that 3.4%, that would include only those individuals who were tested who had severe symptoms, but then there would be a large group of individuals who would not have had severe symptoms, would not have been tested, and therefore the percentage actually might be lower. We also know what happens after you get this disease in terms of the progression, in terms of the mortality. We know that in many ways this virus is behaving like how a usual common flu virus would behave, and not like MERS and SARS, where the mortality rates were way higher, and of course as high as 30% in MERS. So what we are seeing here is a virus which is a coronavirus, but in many ways is behaving in terms of the clinical presentation and the course of illness like an influenza virus. There is now evidence to support that the older the individual, the higher the risk of serious problems. If we look at the median age in the Chinese cohort, it was 59. If you have other conditions, if you have other medical conditions, you are at a greater risk of developing problems. Children less than 15 were not affected by this virus, and children by and large develop a milder illness. A lot of concerns about how infective is it? Well, it is infective in that one individual can infect between 1.5 to 3.5 individuals, but much less than with measles, much less than with chickenpox, which could be as high as 15 individuals per person. How serious an illness is it? Well, it's higher than flu in terms of the mortality rates, but much lower than SARS or SARS and MERS, and of course a lot lower than Ebola. How does human-to-human transmission happen? It happens through droplets when someone coughs, someone sneezes, and that's how the virus goes on to the other individuals, and they get it. It also lands onto surfaces, and from there it can get transmitted to individuals. There are some super sort of spreaders that have been identified where they tend to spread it more, but then that's unusual than other individuals. Travel advisory, this is going to change very frequently. This is something that each one of us needs to be aware of. We should look at the Government of India guidelines and then decide on travel. Management, the management is largely supportive. There is no specific treatment at this point in time. There are certain antiviral drugs that have been studied, and malaria medication has been studied, but at this point in time the treatment is supportive, and if there is a need for intensive care, then of course the individual needs to be provided full ICU care, including ventilation, and sometimes ECMO might be needed. Vaccination, there are about 20 potential candidates that are being looked at, and trials have already I think will start very soon for at least one candidate vaccine, but then because they have to go through multiple phases of trials, we will not have a vaccine in the next few months. Basic precautions, I think the age-old Indian tradition of Namaste needs to be brought back in. We should stop hugging and stop shaking hands. If someone's coughing, they should be requested to wear a mask, and you need a basic 3-ply surgical mask and not N95 expensive mask. We need to cough into the elbow and not into the hands, and if the hands get contaminated, they need to be washed. We need to wash our hands often, and this could be soap and water for at least 20 seconds, or it could be a hand sanitizer. We need to clean the surfaces where we work often, whether it's a table or whether doorknobs and anything that can potentially harbor this virus. So we need to be particular about that. If someone's coughing, we need to be 6 feet away. Less than 6 feet would be considered as close proximity. It's a lot of common sense, really. I think that is really the sheet anchor in terms of prevention. In terms of travel, as I mentioned, we should look at advisories. We shouldn't really be looking at traveling to farms and some of those areas. That wouldn't at this point in time be advisable. I think what COVID has taught each one of us is what our ancient Sanskrit teaching has been, Vasudev Kutumbakam, the world is one family. And I think we are so interconnected today that our lives are intertwined, and that is why we are seeing the kind of spread that we are seeing with COVID-19. But also, because we are one large family, there are tremendous opportunities for us to learn from the experience in other countries and use that experience and enhance our knowledge, and use that knowledge to empower ourselves to be able to fight this virus better. Thank you very much.